Good afternoon, everybody. It's Dr. Dan. It's April 2024, and welcome to the weekly 1 minute here. To talk about strep infections. Strep's been on the rise. We've been getting quite a few cases of strep infection, so thought we'd talk a little bit about strep. Strep throat is caused by a bacteria, Streptococcus pyogenes, group A strep, and some of the kids call it the cooties, all right, because of its infectious nature. So strep throat. Common symptoms with strep throat that we see. Typically, we'll see fever, sore throat, swollen glands. But we don't see that all the time with strep throat. Sometimes with strep infections, we'll see atypical symptoms, such as a skin rash, just a headache, or just abdominal pain. So when I was in training, one of my professors called it the great mimicker. So strep not only would be just the sore throat, fever, swollen glands, but could be some of those atypical symptoms, making it worthwhile, to get tested. History of strep throat: antibiotics were created in the 1920s. We didn't start treating really consistently until the 1940s with penicillin for strep throat, and that was really to prevent the complications from strep, that being acute rheumatic heart disease, which can cause inflammation of the heart. For you avid readers out there, those who read Little Women, we may remember Beth. She was one of the 4 little girls growing up in the mid-1800s. She had a strep infection with bad results. So if anyone is having any of those symptoms, it's worthwhile getting checked out. Here at the office, we do a rapid test. That takes about 10 minutes to get the results back. If the strep test is positive, we treat with antibiotics. With the rapid test, sometimes we'll see false negatives, meaning you might actually have strep throat, but it comes up as a negative test. In those cases, we put the culture in the lab, usually get those results back in a day or two, and if it's positive, then we treat accordingly. For those that are truly negative, we treat like a viral illness. Usually within a couple of days, we should be feeling better. If you're not feeling better from a sore throat with a negative strep test, worthwhile getting tested or reevaluated in 2 or 3 days. There are other things that can cause sore throat in terms of viral illnesses, such as infectious, mononucleosis, Epstein-Barr virus. So things to sort of think about. Okay, so that's a little bit of the history when it comes to strep throat. If you're having any of those symptoms, again, worthwhile getting checked out. We're here Monday through Friday for walk-ins before 10 o'clock. And in good health, everybody. Take care. Thanks for listening.